Hi everyone, hope you're doing well. My name is Varsay Sirleaf and I am a director at Snapper Hill Clinic, and I'm pleased today to bring you another edition of our Courageous Medicine series. My job on this series is to break down tips and insights that are coming from Snapper Hill Clinic. I'm also going to share with you clinic activities, updates on clinic activities, and also bring in guests who can share with us healthcare insights on the continent and in Liberia. So today I would like to share with you four treatment tips from the American Heart Association on a heart condition called heart failure, which is basically a condition where your heart does not pump blood as it should. But before we get into the four tips, it is important to know that early diagnosis and treatment can improve the quality and length of life of people who suffer from heart failure. So, that being said, let's get into the four tips. So, tip number one, reduce the level of sodium in your diet. So, what does that mean? It means that you have to reduce the amount of salted pork, salted or smoked fish, luncheon meat, any type of canned food that has high salt or sodium intake or sodium levels. You definitely have to reduce those because sodium definitely increases high blood pressure, which can lead to heart failure. So tip number one, reduce the level of sodium in your diet by reducing your intake of high sodium food. For tip number two is manage your alcohol consumption levels. So I'm not telling you to stop drinking. I don't think that's a fair assertion to make. But I am saying that according to the American Heart Association, consumption at moderate levels is totally acceptable. Excessive consumption, where you're drinking every day at really high levels, can definitely impact your heart and your heart health and can cause or lead to heart failure. So, tip number two, manage moderate levels of alcohol consumption. Tip number three, reduce your salt intake. Okay, so according to the CDC, the Center for Disease Control, there is a direct relationship between high levels of salt intake and high levels of high blood pressure. And as we know, high blood pressure is a cause of heart failure, okay, because it's an indication, is a disease that impacts the heart's ability to pump blood. And as we know, heart failure is when your heart does not function properly and does not pump blood as it should. And there is a direct relationship between high salt intake and high blood pressure. The tip number three is to reduce your amount of salt intake, and that can help to reduce your risk of heart failure. And then last but certainly not least, tip number four, exercise. So it's important to get that physical activity going so that your blood is going and flowing, your heart is pumping, your arteries are working, and you're basically strengthening your heart muscle. As much as you can, strengthen your heart, get your exercise in, get your blood flowing. That helps to reduce, again, the risk of heart failure because you are basically strengthening the organ against any of these diseases and basically gets it going. So tip number four from the American Heart Association, exercise regularly. If it's walking, if it's jogging, but just getting that activity in, that definitely helps. So tip number four, exercise regularly as much as you can. So thank you all again for your time and your attention in this another edition of Courageous Medicine series. If you want to learn more about heart failure, you can certainly come to the clinic. We're at the corner of Ashman and Robert Street in Central Monrovia. You can also call us at 231-881-432-584, or you can call us on Orange at 231-775-43584. You can also email us at info@snapperhill.com. Again, that's info@snapperhill.com. Thank you so much for your time. Hope these 4 tips were helpful for you. Live well, be safe until we talk again. Take care. Bye bye.